Hey everyone, and welcome back to the Deep Dive. Today we're going to tackle something that's like super fundamental to nursing preventive healthcare. You know, the stuff that helps people actually just stay healthy in the first place. We're going deep into like a mountain of research and guidelines, the kind that can like totally make your head spin. But don't worry, we're here to bring you the need-to-know info, stuff that'll make you feel confident and ready to rock in your practice.
It's kind of like finding those hidden gems in a giant library, right?
Yeah.
There's so much out there, but we're going to zero in on what's truly relevant and impactful, the stuff that'll actually make a difference for your patients.
Exactly. And to help us sort through it all, we've got some pretty cool tools. Systems like Grade and the USPSTF, they're like filters for all that research, highlighting the recommendations with the strongest evidence.
Those systems are key, because you're going to face a constant barrage of information throughout your careers. These systems help you cut through the noise and figure out what's reliable, what really works.
So it's about making sure the care we give is rooted in solid science, not just, hunches or outdated practices.
Precisely. Now, before we get into the specifics, let's take a step back and appreciate the power of prevention. Over the past 50 years, we've seen a dramatic drop in debilitating illnesses, and a big chunk of that is thanks to preventive care.
It's like we're rewriting the story of health, right? We're not just reacting to illness anymore, we're actively trying to prevent it.
Exactly. And a lot of that comes down to empowering patients. The World Health Organization talks about this in their Ottawa Charter for Health Promotion. It's all about giving people the knowledge and the tools to take charge of their well-being.
It's not just about us as nurses telling people what to do, but helping them understand how to actively participate in their own health, make healthy choices because they want to.
Precisely. Now let's zoom in on one of the tools in our preventative care arsenal, screening.
All right, screening. I know we do it all the time, but what's the big picture? What are we actually trying to achieve when we screen patients?
So screening is all about testing people before they have symptoms, catching diseases early, maybe even before they fully develop. It's like detective work, searching for clues before the crime happens.
Makes sense. But we obviously can't screen for everything. How do we decide which conditions to focus on?
That's where those evidence-based criteria come in. We target diseases that are a big deal in public health, affecting lots of people, conditions with a clear path of progression. We understand how they develop. And super important, we need effective treatments. No point in screening for something if we can't do anything about it, right?
Absolutely not. So that's where those rating systems like Grade and USPSTF come in again, right? Helping us make sure the screenings we're doing actually make a difference.
You got it. The gold standard is the Randomized Controlled Trial, or RCT. We randomly assign people to either get screened or not, and then follow them over time. See if screening really moves the needle, if it actually improves outcomes.
So we're not just guessing or going with what's always been done. We're using hard data to make decisions.
Exactly. Okay, so moving beyond screenings, let's talk about behavioral counseling, which is, way more than just giving advice.
Yeah, we all know we should eat healthy and exercise, but actually changing those habits, way harder than just knowing what to do.
That's where understanding the stages of change can really help. There's this model, it's called the Prochaska and DiClemente Transtheoretical model, sometimes called the Stages of Behavioral Change model. It breaks down how people actually move towards making lasting changes.
Okay, I'm intrigued. Tell me more about these stages.
There are 5 main stages: precontemplation, contemplation, preparation, action, and maintenance. So in precontemplation, someone isn't even thinking about changing. Then they might move into contemplation where they're like, maybe there's a problem, but they're not ready to act yet.
So it's a journey, right? And everyone's starting at a different point. Not everyone's going to be ready to jump into action right away.
Exactly. And here's the thing. It's not always a straight line. People can relapse. They might go back and forth between stages. The key for us is to tailor our approach to where they are right now and to their self-efficacy, basically their belief in their ability to make the change.
It's about meeting them where they are, supporting them along the way, not expecting them to make some huge overnight transformation.
Exactly. And to really guide patients through these stages, there's a powerful tool we can use: motivational interviewing.
Okay, I've heard that term before.
Oh.
What does it actually look like when you're working with a patient?
Motivational interviewing is all about collaboration, working with the patient to help them work through their ambivalence about change. We're not telling them what to do, we're helping them discover their own reasons for change.
So it's more about asking the right questions,
Right.
listening carefully, than it is about, lecturing or giving orders.
You got it. It's about those core communication skills we've talked about before. Motivational interviewing builds on those skills, creates a space where patients feel truly heard and understood.
Like weaving together all these essential skills to create this like tapestry of effective care. Now, before we get into specific recommendations, I think we need to talk about a cornerstone of preventive healthcare immunizations.
Oh, for sure. Immunizations have been a game changer in public health, drastically reducing the spread of infectious diseases. It's not just about protecting individuals, it's about creating herd immunity, shielding entire communities.
It's like this chain reaction of protection, reaching even those who can't be vaccinated. But I've got to admit, I've always been a little fuzzy on the difference between immunization and vaccination. Are they the same thing?
It's a common question. It's subtle, but important. So immunization refers to the process of becoming immune to a disease. Vaccination is the act of administering the vaccine itself. So vaccination is the tool, immunization is the outcome. A stronger, more resilient immune system.
Ah, okay, that makes total sense. Vaccination is the key. Immunization is that open door, that protection.
Exactly. All right, so with those foundational principles in mind, let's jump into specific screening and counseling recommendations. The practical stuff you'll be using every day in your nursing careers.
Okay, let's get down to the nitty-gritty. I'm ready to learn about what we should be looking for and how we can help patients make healthy choices.
Let's start with unhealthy weight and diabetes. This is a huge issue. Obesity affects a significant portion of the population. And we use BMI, body mass index, as a tool to assess weight status, identify people who might be at risk for problems down the road.
So BMI is more than just a number on a chart. It can be a signal that we need to dig a little deeper, address potential risks.
Exactly. And when it comes to diabetes, the USPSTF recommends blood glucose screening for overweight or obese adults between 40 and 70.
Which makes sense, right? Obesity increases the risk of developing diabetes, which can lead to a whole cascade of complications.
It's all about connecting the dots, seeing the bigger picture when it comes to prevention.
Okay, switching gears a bit, let's talk about substance use disorders, another critical area where nurses play a vital role.
This can be a tough topic to bring up, but it's so important to remember that substance use disorders are medical conditions, not moral failings.
Absolutely. And sometimes just asking the right question can open the door. The National Institute on Drug Abuse recommends this single screening question. How many times in the past year have you used an illegal drug or used a prescription medication for non-medical reasons?
Straightforward, to the point. What happens if someone says yes? What do we do then?
We got to dig deeper. Find out what drugs specifically, how often, what the patterns of use are. It's about assessing their level of risk, seeing if they need further intervention or referral for treatment.
So it's not just asking a question and moving on. It's using that answer to guide our next steps, make sure they get the appropriate care. You got it. It's about using our assessment skills to tailor our approach to each individual patient. All right, let's talk about a topic that can be really sensitive. Intimate partner violence, elder abuse, and abuse of vulnerable adults.
It's definitely challenging, but as nurses, we're often in a position to spot these issues and connect patients with help.
Absolutely. It's a tough conversation to start, but statistics show that abuse is alarmingly prevalent. The key is creating a safe space, a non-judgmental environment for patients to share their experiences.
How do we even begin to approach this topic in a way that's sensitive and effective?
The USPSTF recommends normalizing statements. Things like, because abuse is common in the lives of many of my patients, I've started asking about it routinely. It takes the pressure off and lets them know they're not alone.
That makes a lot of sense, yeah.
Yeah.
It sets the tone for a conversation where they feel comfortable opening up.
Exactly. Then we can ask more specific questions, like, are there times in your relationships that you feel unsafe or afraid? Or have you ever been hit, kicked, punched, or hurt by someone you know?
Direct, but still framed in a way that's respectful and avoids judgment. What happens if they do disclose abuse? What do we do next?
The USPSTF recommends using validated screening tools, things like the HITES or HR questionnaires. And if abuse is confirmed, we need to connect them with appropriate resources, counseling, advocacy groups, legal aid.
It's about going beyond just identifying the problem and actually helping them access the support they need.
Exactly. Okay, let's shift gears a bit and talk about something that comes up all the time in healthcare: weight loss.
Weight loss can be tricky, and it's important to approach it with sensitivity. Focus on realistic goals, healthy habits.
You're absolutely right. Crash diets and extreme measures, they rarely work in the long run, and they can even be harmful. What we want to do is help patients develop healthy habits they can stick with.
Creating a lifestyle change, not just a quick fix. What are some of the strategies that actually work?
The USPSTF recommends intensive multi-component behavioral interventions, combining changes in diet with increased physical activity. These interventions often involve things like self-monitoring, tracking your weight, using tools like pedometers or food diaries, and motivational counseling sessions.
So a holistic approach that addresses both the physical and psychological aspects of weight management.
Exactly. And when it comes to setting goals, we got to keep things realistic, right? A healthy, achievable goal for weight loss is 0.5 to 2 pounds per week. Even a small reduction, like 5% to 10% of body weight, can have a big impact on health outcomes.
That's encouraging. Even small, sustainable changes can make a big difference over time. All right, I think it's time to talk about two cornerstones of a healthy lifestyle diet and physical activity.
These are absolutely essential elements of preventive healthcare with far-reaching benefits for both physical and mental well-being.
So, as nurses, how can we effectively guide our patients in these areas? What are the key recommendations we should be sharing?
The U.S. Dietary Guidelines for Americans are a great framework. We should be emphasizing limiting sodium to lower the risk of high blood pressure, keeping added sugars and saturated fats below 10% of total calories. And if they drink alcohol, doing so in moderation.
Okay, those are great guidelines, but how do we translate that into everyday life for our patients? Any tools or resources we can use?
Absolutely. The USDA's 10 Tips, Choose My Plate is fantastic. It gives simple, actionable advice on building balanced meals focusing on fruits, vegetables, whole grains, lean protein. They even have a visual aid. The MyPlate graphic helps people understand portion sizes.
I love that. Visuals can be so helpful for people to grasp and remember information. Okay, let's move on to physical activity. What are the current recommendations for adults?
The 2018 Physical Activity Guidelines for Americans are really comprehensive. The main takeaway is that adults should aim for at least 150 to 300 minutes of moderate intensity aerobic activity, or 75 to 150 minutes of vigorous intensity each week.
That might sound like a lot for someone who's been inactive, but I guess the message is to start slow, gradually increase activity level over time.
Exactly. It's about finding activities they enjoy and can fit into their lives. And don't forget about muscle strengthening activities at least twice a week.
Finding that balance between cardio and strength training for overall fitness. All right, let's talk about a topic that can be a bit more sensitive: unhealthy alcohol use.
Definitely a conversation that calls for tact and empathy. But considering how much alcohol can impact health, it's one we can't shy away from.
So how do we approach this topic in a way that's both effective and respectful?
I think the first step is normalizing the conversation. Acknowledging that alcohol use is common, but for some people it can become a problem. And there are validated screening tools we can use, like the Audi ITC or the CAGE questionnaire. They help us assess a patient's risk level.
Those tools give us a structured way to talk about drinking habits without making the patient feel judged or defensive.
Exactly. If a patient scores high on a screening, we can dig a bit deeper. Ask about things like blackouts or injuries related to drinking, any negative consequences they've experienced, relationship problems, trouble at work, that sort of thing.
It's about connecting the dots, looking for patterns that suggest alcohol might be having a negative impact on their life.
Right. And for patients who are struggling, one effective approach is the SBIRT program. That's screening, brief intervention, and referral to treatment.
SBIRT, I've heard of that. What does it involve?
It's designed to be used by healthcare providers, not just addiction specialists. So, brief interventions typically involve educating the patient about the risks of exceeding drinking limits, exploring how their alcohol use might be connected to other health problems, and using motivational interviewing techniques to help them set their own goals for cutting back.
It's all about empowering them to take ownership of their health, make positive changes.
Exactly. And if their needs are beyond what we can provide in a brief intervention, we can refer them to specialized treatment.
It's like a safety net, making sure they get the level of care they need. All right, let's shift gears and talk about another big public health challenge: tobacco use.
We've made some progress in reducing smoking rates, but tobacco is still a leading cause of preventable disease and death.
And as nurses, we're right on the front lines, helping people quit. What are some effective ways to engage patients in conversations about quitting?
The USPSTF strongly recommends screening all adults for tobacco use and offering cessation interventions for those who need them.
It's not just about asking if they smoke. It's about actively offering help to those who are ready to make a change.
Absolutely. And we need to remember that teenagers are super vulnerable to nicotine addiction. It's crucial to talk to them about the risks, the long-term consequences, the reality that quitting is a lot harder than they might think.
Giving them the facts, helping them understand just how serious tobacco addiction can be.
Right. And for those who are ready to quit, there's a framework we can use to guide our interventions, the 5 A's. Ask, advise, assess, assist, and arrange.
Okay, tell me more about these 5 A's. How do we put them into action?
So first we ask about tobacco use, every patient, every interaction. Then we advise them to quit, emphasizing the health benefits. We assess their willingness to make a quit attempt, meeting them where they are in terms of readiness.
It's not about pushing them before they're ready. It's about respecting their autonomy, tailoring our approach.
Exactly. Once they are ready, we assist them in their quit attempt. Offer practical strategies, connect them with resources like the National Smoking Cessation Hotline, and finally, we arrange follow-up. Provide ongoing support, help them stay on track.
Compassionate and comprehensive. Recognizing that quitting smoking is a process, not a one-time event.
And we should remember that a combination of behavioral counseling and pharmacotherapy is usually the most effective approach.
So we're addressing both the psychological and physical aspects of addiction. What kinds of medications are used?
There's nicotine replacement therapy, which comes in a variety of forms: patches, gum, lozenges, inhalers. And then there are prescription meds like varenicline and bupropion, which work by reducing cravings and withdrawal symptoms.
Like having a whole toolkit of options, tailoring treatment to each patient's needs and preferences.
Exactly. Now let's dive into another sensitive but crucial topic: screening and counseling for sexually transmitted infections, or STIs, including HIV/AIDS.
This is definitely an area where clear communication, empathy, and a non-judgmental approach are absolutely essential.
Couldn't agree more. We need to create that space where patients feel comfortable talking about their sexual health openly, honestly, without fear of shame or stigma. And that starts with us being knowledgeable, approachable, and sensitive.
Putting patients at ease, letting them know we're here to support them, not judge them.
Precisely. So let's get into some specifics about screening for common STIs. The USPSTF recommends chlamydia and gonorrhea screening for all sexually active women 24 and younger. The CDC recommends yearly screening for sexually active women under 25, as well as older women with specific risk factors.
It seems like it's about focusing on those who are most at risk, ensuring they have access to early detection and treatment.
Exactly. Now, for syphilis, the USPSTF recommends screening high-risk adults and adolescents who are not pregnant. This includes men who have sex with men, people with HIV, individuals with a history of incarceration or commercial sex work. They also recommend screening all pregnant women.
So tailoring recommendations to different populations based on their risk factors. What about HIV screening? What are the guidelines there?
The USPSTF recommends HIV screening for everyone between 15 and 65 and for all pregnant women. They also recommend screening younger teens and older adults who are at increased risk.
That's pretty broad. It really highlights how important routine HIV screening is.
Absolutely. And the CDC recommends an opt-out approach to HIV testing, meaning patients are told that testing will be done unless they specifically decline. Helps to normalize it, reduce some of the stigma.
A subtle but important shift. Making HIV testing part of routine care instead of something you have to specifically ask for.
Exactly. Now, beyond screening, counseling is huge in STI prevention. We need to gather a detailed sexual history. That means asking about the number of partners, any history of past STIs, the genders of their partners, and the types of sexual practices they engage in.
Getting a complete picture, avoiding assumptions based on someone's identity or relationship status.
You got it. And don't forget to ask about the use of toys or objects during sex. That can impact risk and prevention strategies. Our counseling should be patient-centered, non-judgmental, and tailored to their individual risk behaviors.
So we're not lecturing or shaming. We're providing personalized guidance and empowering patients to make informed decisions.
Precisely. We need to discuss things like using condoms consistently and correctly, reducing the number of partners, and getting vaccinated for Hep B and HPV.
And for those at high risk for HIV, there's PEP, or pre-exposure prophylaxis. It's a daily medication that can significantly reduce the risk of infection.
PEP has been a game changer. Okay, we've covered a lot of ground with screenings and counseling. Now let's talk about another crucial part of preventive care: immunizations.
Okay, immunizations. We've touched on them broadly, but I'm ready to hear more about specific recommendations for adults.
Sounds good. Let's start with a familiar one: the flu vaccine.
The flu shot. I think most people know about that one. Why is it so important to get vaccinated every year?
Influenza can be a really serious illness, especially for older adults, pregnant women, and people with chronic health conditions. The flu vaccine is the best protection for ourselves and those around us, and it's recommended for everyone 6 months and older.
I've heard the flu virus changes constantly, which is why we need a new vaccine every year. Is that right?
You got it. It's constantly evolving, so the vaccine is updated every year to target the strains that are predicted to be circulating. So, yeah, you need a new shot every year, even if you got one last year.
It's like an annual tune-up for our immune systems.
I love that. All right, let's talk about another important one, the pneumococcal vaccine. This one protects against serious infections like pneumonia, meningitis, and bacteremia.
I know there are actually two types of pneumococcal vaccines, PCV13 and PPSV23. Can you explain the difference? When each one's recommended?
Sure. So typically the PCV13, that's the pneumococcal conjugate vaccine, is given first, followed by the PPSV23 or pneumococcal polysaccharide vaccine at least a year later. For adults 65 and older who haven't had either vaccine, the PCV13 comes first, and then the PPSV23 a year later.
A two-step approach for optimal protection. What about the varicella vaccine, which protects against chickenpox? Most people get chickenpox as kids. Is it still a concern for adults?
Chickenpox is usually mild in kids, but it can be much more serious in adults, leading to things like pneumonia and encephalitis. The CDC recommends 2 doses of the varicella vaccine for adults who haven't had chickenpox or been vaccinated.
So even if you had a mild case as a kid, it's still worth getting vaccinated as an adult just to avoid those potential complications.
You got it. Now, the herpes zoster vaccine, this one protects against shingles.
Shingles is another one of those things I heard can be incredibly painful, and it's caused by the same virus as chickenpox, right?
That's right, the varicella zoster virus. It can lie dormant in the body for years and reactivate later in life, causing shingles. It's a painful rash that can linger for weeks, even months. And some people experience long-term pain, even after the rash clears.
So who should get the shingles vaccine? When's it recommended?
The CDC recommends it for all adults 50 and older, even if they've already had shingles. There's a newer vaccine out now called Shingrix that's more effective than the older one, Zostavax. Shingrix is given in 2 doses, 2 to 6 months apart.
It's great that there's a more effective option available. What about the tetanus, diphtheria, and pertussis vaccine, or Tdap?
These 3 bacterial infections can be very serious, and the Tdap vaccine provides protection against all of them. It's recommended for all adults, with a booster dose every 10 years. Pregnant women should also get it during each pregnancy to protect their newborns from pertussis, which is also known as whooping cough.
So even if you got vaccinated as a kid, it's important to stay up to date with those boosters throughout adulthood. Okay, what about the human papillomavirus, or HPV vaccine? This one's relatively new compared to some of the others.
The HPV vaccine is incredibly effective at preventing several types of cancer: cervical, anal, or pharyngeal cancers. It's a huge step forward in cancer prevention.
That's amazing. It's incredible that vaccines can actually protect us from cancer. Who should get the HPV vaccine, and when?
The CDC recommends it for all adolescents starting around 11 or 12. You can get it as early as 9, and catch-up vaccination is recommended for anyone up to 26 who hasn't been vaccinated.
Starting early is ideal, but even young adults who missed out can still benefit.
Absolutely. And the FDA recently approved the HPV vaccine for adults up to age 45, so even more people can protect themselves from HPV-related cancers.
That's fantastic news. Okay, let's wrap up our discussion of adult immunizations with the hepatitis A and B vaccines.
Hepatitis A and B are viral infections that can cause serious liver damage. The hepatitis A vaccine is recommended for people at increased risk, like those traveling to areas where it's common, men who have sex with men, and people who use injection or non-injection drugs.
What about Hep B? Who should get that one?
Hep B is recommended for all infants, and catch-up vaccination is recommended for adults who haven't been vaccinated. Certain groups are at higher risk: healthcare workers, people with chronic liver disease, and those with multiple sexual partners. It's about assessing risk factors for each patient to determine if they need the Hep A and B vaccines.
It sounds like we've covered a ton of information, from the big picture principles of preventive healthcare to really specific recommendations for screenings, counseling, and adult immunizations.
We have covered a lot, but it's all about equipping you with the knowledge and skills to make a difference in your patients' lives.
It's about helping them take control of their health and well-being, making informed decisions throughout their lives.
Exactly. All right, before we move on, I want to leave our listeners with a question to ponder. We've talked about a lot of established measures, but what about the future of preventative healthcare? What new trends or technologies are on the horizon that could change how we think about prevention?
Hmm. That's a great question. We're seeing amazing advancements in personalized medicine and genetic screening. Imagine tailoring preventive care to someone's specific genes.
That would be incredible. And what about telehealth? It has the potential to make preventive care much more accessible, particularly for folks in rural areas or underserved communities.
Absolutely. Telehealth could revolutionize how we deliver preventive care, make it more convenient for everyone. It's an exciting time to be in healthcare. I completely agree. All right, that's it for this part of the deep dive. We'll be back with more on preventive healthcare, exploring specific conditions and recommendations in detail. Stay tuned.
Encourage them to quit smoking, eat a heart-healthy diet, get regular exercise, and maintain a healthy weight.
All things we've talked about, but good to emphasize how important they are for heart health.
Absolutely. And for some patients, we might recommend meds to lower blood pressure or cholesterol. It really depends on their risk factors.
So it's like a combo of lifestyle changes and medical interventions, whatever works best for each individual.
You got it. Personalized care is key. Speaking of personalized care, let's touch on mental health.
Yeah, mental health is often overlooked, but it's so crucial for overall well-being. It's all connected.
It really is. And mental health disorders are really common, way more than people think. They can have a huge impact on people's lives.
As nurses, how can we help promote mental health and prevent mental illness? What can we actually do?
Well, first off, we need to create a safe space, a judgment-free zone where patients feel comfortable talking about their mental health. We also need to know the signs and symptoms of common disorders, depression, anxiety, substance use disorders.
Being observant, asking the right questions, and really listening to what our patients are telling us.
Exactly. And if we think someone might be struggling, we can refer them to the right resources. Counseling, support groups, maybe medication management, it all depends.
It's about recognizing that mental health is just as important as physical health, making sure patients have access to the right care, whatever that looks like for them.
Couldn't agree more. All right, let's switch gears again. Let's talk about oral health.
Oral health. I know it's important. I just never really thought about it in terms of preventive care,
A lot of people don't. They don't realize how important it is for overall well-being. Poor oral health has actually been linked to some pretty serious health issues, heart disease, stroke, diabetes.
Whoa, seriously. I had no idea it was connected to all that.
It's all about inflammation. When you have gum disease, those bacteria can get into your bloodstream. They travel to other parts of your body, trigger inflammation, and that can contribute to those chronic diseases.
So taking care of our teeth and gums is more than just about having a nice smile. It's about our overall health.
Exactly. So what are some things we should be telling our patients about oral health?
The basics are key, right? Brush twice a day, floss every day, see the dentist for regular checkups and cleanings.
Those are the foundation for sure. We can also talk to them about limiting sugary drinks, chewing sugar-free gum after meals, and using fluoride toothpaste.
A lot of those things are good for overall health, too. It's all connected.
It really is. And of course, for patients with certain risk factors like diabetes or a weakened immune system, we may need to give more specific advice.
It's all about personalized care, right? Meeting each patient where they are.
Absolutely. All right, let's switch gears again. Let's talk about fall prevention, something that's particularly important as people get older.
Falls are a huge concern for older adults, and they can have serious consequences. Injuries, loss of independence, even death.
No doubt. But the good news is that a lot of falls are preventable.
So as nurses, how can we help prevent falls? What are some key things we should be doing?
Well, it starts with a good assessment, figuring out their risk factors, things like age, medical history, medications, vision, balance, and their home environment.
Yeah.
It all plays a part.
A holistic assessment, considering both their physical condition and their surroundings.
Exactly. Once we've got a handle on their risk factors, we can start to develop a personalized plan for fall prevention.
What would that kind of plan involve?
Well, exercise is really important. We want to encourage activities that improve strength, balance, and flexibility.
So not just getting their heart rate up, but targeting those muscle groups that help with stability and coordination.
Exactly. And we need to make sure they're wearing good shoes, supportive, non-slip, that sort of thing.
And what about their home environment? Are there things we can suggest to make it safer?
For sure. Removing tripping hazards, clutter and stuff, installing grab bars in the bathroom, improving the lighting throughout the house. Little things can make a big difference.
Creating a safe and supportive environment, reducing those risks.
Absolutely. Now, let's talk about social engagement. It might seem like a strange topic for preventive care, But it's more important than you might think, especially for older adults.
Social engagement. How does that tie in?
Well, social isolation and loneliness are big problems for older adults, and they've been linked to all sorts of negative health outcomes, cognitive decline, depression, even higher mortality rates.
So staying connected, staying active in your community, it's more than just about happiness. It's actually crucial for health.
Exactly. So as nurses, we can encourage social engagement, connect our patients with community resources, support groups, volunteer opportunities, encourage them to stay in touch with loved ones, pursue hobbies they enjoy, anything that keeps them engaged and connected.
Helping them find ways to stay involved, maintain those social connections.
Now, let's tackle a topic that can be a little bit tricky, but it's incredibly important: advanced care planning.
Advanced care planning, yeah.
Yeah.
It's about making sure people's wishes are honored, especially towards the end of life.
That's it. It's about having those conversations with patients, finding out what's important to them, their values, their goals, their preferences for care if they're ever unable to make decisions for themselves.
Those conversations can be tough, but they're so necessary.
They really are. And we should start those conversations early, before a crisis hits. We can encourage patients to fill out advance directives, living wills, durable power of attorney for healthcare.
Giving them a voice, even when they can't speak for themselves, that's powerful.
It is. Okay, let's move on to something that's essential for everyone: sleep.
Sleep. Yeah, we all know how important it is to get a good night's rest.
But it's more than just feeling rested. Sleep is essential for our physical and mental health. Not getting enough sleep, chronic sleep deprivation, has been linked to a whole bunch of problems: obesity, diabetes, heart disease, depression, anxiety, you name it.
It's amazing how much sleep can affect our health.
It really is.
So as nurses, we should talk to our patients about their sleep habits. Encourage them to create a regular sleep schedule, a relaxing bedtime routine, avoid caffeine and alcohol before bed. Simple things, but they can make a huge difference.
Good advice. And if someone's really struggling, we can refer them to a sleep specialist.
Right. Let's switch gears again. This one can be a little tricky to talk about: sexual health.
Sexual health is definitely something that can be uncomfortable to discuss, but it's important for people of all ages. It shouldn't be taboo.
I agree. And as nurses, we need to be comfortable addressing sexual health concerns in a way that's sensitive and non-judgmental.
So what are some of the key things we should be talking to our patients about when it comes to sexual health? Well, it depends on the patient, of course. For younger patients, we might talk about safe sex, contraception, STIs. For older adults, we might discuss age-related changes in sexual function. It's all about helping them maintain a healthy and fulfilling sex life, whatever that looks like for them.
It's recognizing that sexual health is important throughout life, not just when you're young.
Exactly. And we can't forget that sometimes sexual health concerns can be a sign of underlying medical conditions. We need to keep that in mind.
It's about taking a holistic view, considering all the factors that might be at play.
Absolutely. Okay, let's talk about sun safety. This is one that's easy to overlook, but so important.
Sun safety is key for everyone, but especially for people who spend a lot of time outside or have fair skin.
Right. Too much sun can lead to premature aging, wrinkles, and most importantly, skin cancer.
So what should we be telling our patients about sun safety?
The basics are important: protective clothing, like hats, long sleeves, sunglasses, seeking shade when you can, and of course, sunscreen. SPF 30 or higher, reapply every 2 hours, even on cloudy days.
Those simple precautions can really protect their skin from sun damage in the long run.
Now, one last topic that's often associated with childhood, but is important for adults too: immunizations.
We've already talked about some key adult vaccines, but is there anything else we should know?
Yeah, there are a few other vaccines adults may need depending on their individual risks and health history.
Okay, what are those?
One is the meningococcal vaccine. Meningococcal disease is a serious bacterial infection. It can cause meningitis and sepsis.
That sounds scary.
It can be, but vaccination can prevent most cases.
So who should get it?
The CDC recommends it for all adolescents, with a booster at 16. Adults at increased risk, like college students in dorms, military recruits, and people traveling to certain areas, should also get vaccinated.
It's all about protecting those most at risk.
Exactly. Another one is the hepatitis A vaccine.
We've already covered Hep B. What about Hep A?
Hepatitis A is a viral infection that affects the liver. It's spread through contaminated food and water and through close contact with an infected person.
So travelers to certain areas or people with certain lifestyles might be at risk.
Right. The CDC recommends it for all kids at 1 year old and catch-up vaccination for anyone older who hasn't been vaccinated.
Another one to keep in mind.
And last but not least, there's the typhoid fever vaccine.
Typhoid fever. Isn't that something people get when they travel to, like, developing countries?
It's most common in areas with poor sanitation. It's a bacterial infection. It can cause high fever, headaches, abdominal pain, all sorts of nasty stuff.
So it's recommended for people traveling to those regions.
Exactly. The CDC recommends it for anyone traveling to countries where typhoid fever is common and for people who have close contact with someone who carries the bacteria.
So travel history is important to consider, and potential exposures as well when making recommendations.
You got it. So we've covered a lot of ground today. Cancer screenings, heart health, mental health, oral health, fall prevention, advanced care planning, sleep, sexual health, sun safety, and even a few more adult vaccines.
Wow. We've been busy. It's a lot. But it's also important for providing well-rounded, comprehensive preventive care to our patients.
It's about giving them the knowledge and tools to take charge of their health throughout their lives. Before we wrap up, I want to share a few key takeaways, things to really remember about preventive care.
I'm ready. Lay it on me.
First, remember that prevention is always better than cure. If we can identify and address risk factors early, we can help our patients avoid so many problems down the road.
Prevention is the best medicine. I love that.
Absolutely. Second, preventive care is a team effort. It's not just about what we do as nurses, it's about partnering with our patients, working together to achieve their health goals.
Empowering them to be active participants in their own care. It makes all the difference.
And finally, remember that preventive care is a lifelong journey. It's not a one-and-done kind of thing. We need to be constantly assessing, reevaluating our patients' needs, adjusting our approach as they age, as their health changes.
Being their advocates, supporting them every step of the way. Well, I think we've given our listeners a lot to think about today.
I hope so. We always encourage you to share your thoughts, experiences, questions. We love hearing from you.
We're all in this together.
It's been a pleasure diving deep into this topic with you and our listeners.
Me too. And until next time, stay curious, stay informed, and keep those brains buzzing.
Yeah, it really has been quite the journey. I think we've done a good job giving our listeners a solid foundation in preventive healthcare.
For sure. It's all about being proactive, right? Partnering with our patients and staying up to date on those evidence-based recommendations.
Absolutely. It's not just about memorizing facts. It's about using that knowledge to actually improve people's lives.
Couldn't have said it better myself. Now, before we wrap things up, I want to leave our listeners with something to think about.
Ooh, I like where this is going. Give us that brain teaser.
Okay, so we've covered a lot of ground today, but healthcare is always changing, right? What are some of those big trends, those up-and-coming technologies that could totally change how we approach prevention in the future?
That is a fantastic question. I mean, we're already seeing such amazing things happening with personalized medicine and genetic screening. Just imagine being able to tailor preventative interventions to a person's specific genes. That's powerful stuff.
That would be incredible.
Yeah.
What about telehealth? It seems like that could make preventive care so much more accessible, especially for people in rural areas or those who don't have easy access to healthcare.
Oh, absolutely. Telehealth has the potential to really change how we deliver preventive care, making it more convenient and more accessible for everyone. It's a really exciting time to be in healthcare.
I totally agree. Well, folks, that's it for this episode of The Deep Dive. We've explored the core principles of preventative healthcare, everything from screenings and immunizations to behavioral counseling and so much more. And remember, as future nurses, you have the power to make a huge difference in the lives of your patients by advocating for and providing top-notch preventive care.
It's been a pleasure diving into this topic with you and all our listeners. Until next time, stay curious, stay informed, and keep those brains buzzing.
And that's a wrap on this episode of The Deep Dive. We'll see you next time for another exciting exploration of healthcare knowledge. Thanks for listening.